Okay, and now I'm going to be doing my practice video for my Ivpb. And the first thing I want to do is compare my doctor's order to my MAR. I'm looking for the right time, the right route, the right amount, the right medication, and the right patient. And we are going to be given ceftriaxone 2 milligrams Ivpb every 24 hours. I'm going to make sure that my patient doesn't have any allergies, and it says no known drug allergies. I want to go ahead and state that I have already worked my drug problems. So we are going to be given this medication by gravity. So I'm going to be given 33 drops, doing 33 drops per minute, 8 drops for 15 seconds. Or if I was to be given it by pump, I would set the pump at 200 milliliters per hour. And also while I'm holding this and the doctor's order in the MAR, I'm going to go ahead and pick up my medication. I want to check my medication bag for the right medication, of course. And then I want to check for any separation, any cracks, any leaks, anything abnormal with the bag. And then I want to go ahead and check the expiration date, make sure my medication is still good and everything is fine with the medication. All right, so we're good here. The next thing I want to do is get my drug book and read about my medication and make sure what we're given is a safe dose and make sure what we have it diluted with is safe. So it says the safe dose is 1 to 2 grams in 24 hours, and we're given 2 grams in 24 hours, so that's safe. For dilution, it says initially reconstitute each 250 milligrams of sterile powder with 2.4 mLs of sterile water, normal saline, D5W, D10W, D5 normal saline, or D5.5 normal saline, and we have D5 hanging, so we're good there. It also says under compatibility, and it says this bolded, it says do not use any diluent that contains calcium, such as any type of lactated bringer solution. So I wanted to state that we're not using any type of lactated bringer solution. The rate of administration for this drug is a single dose is to be given over 30 minutes. So it'll take 30 minutes for this drug to run in. And then precautions, you want to avoid prolonged use of this drug, and you want to watch for early symptoms of a hypersensitivity reaction. You want to monitor their PT and INR and administer vitamin K as indicated. You want to monitor CBC for development of cephalosporin-induced anemia, and you want to ensure adequate hydration and monitor renal functions. So before giving the drug, you want to monitor those labs and make sure they're within safe ranges before you administer the medications. And some side effects that you want to watch for while you're given is just your normal anaphylactic reactions. Make sure, because it can cause that, so you want to make sure your patient doesn't have any dizziness or any shortness of breath reported while the medication is being administered. Okay, so we have read about our drug, we know that everything is safe, and now we are ready to prepare our equipment. So before I touch any of my equipment, I'm going to wash my hands. Okay, my hands are washed, and I have my bag of medication here, and I'm going to go ahead and put my label on it. So I have my label here. On my label, I would want to make sure to put my patient's initials, the dose of medication, so ceftriaxone 2 grams, and then I would want to put the date and time that I have prepared the medication, and then my initials because I'm the one who has prepared the medication. Okay, so I have my medication ready, and then I have my secondary tubing here, and I also have my hanger that I'm going to need, and I have my alcohol pads. So before I connect the tubing, I'm going to take it out of the packaging, and this is brand new tubing. Take it out of the packaging, and the tubing needs to be primed. And we can prime it using our piggyback here. So we want to take this off, being careful not to contaminate, and take our cap off of here. And we want to spike our bag. All right, so our bag is spiked. I'm going to turn it over. And make sure to get some medication in my chamber first. All right, and now I'm gonna open it up a little. Making sure I don't have any kinks in my tubing, just checking on my tubing. Okay, there we go. Let that air bubble come out. Okay. All right, so my tubing is primed. All right, now that I have my tubing primed and my label is on my medication, I am ready to go to my patient's room. So I have my tubing and my medication. I have my hanger to lower my primary IV fluids, and I have some alcohol wipes and my MAR. So from here, I'm going to my patient's room. Once I'm in my patient's room, I want to first verify their, I'm going to verify their name and their date of birth, and verify their armband and make sure that I have the right patient. All right, and then I want to ask my patient if they have any allergies. I know we looked at that in that order, but we want to verify that with them as well. And then we want to explain the procedure. So we want to explain that the doctor has ordered ceftriaxone to be administered IV piggyback, that this requires no additional needle sticks, that we're going to attach this to his IV that's already flowing, that this is going to be running for 30 minutes, and that some of the side effects that he may experience, and that we're going to be watching for those and monitoring while this medication is running in, and that this is an antibiotic that the doctor has ordered. Okay, so I want to wash my hands. I'm going to set my equipment down. So I want to wash my hands. And I want to check my IV site. I want to make sure I don't see any redness, edema, sweat, any like infiltration, any pain, tenderness. Ask the patient if they have any pain, if anything's uncomfortable. If there was, we would fix that before. I want to make sure that my IV's flowing, everything's working properly, and it is. So I want to make sure my IV is patent, and I'm going to do that by lowering the bag below the arm level. Okay, and checking for blood return. All right, and we're good there. So while I have this bag down, I'm going to go ahead and lower it, because for the piggyback, you have to lower your primary IV bag. Okay, so I am going to lower this bag. That is lowered. All right, and now I'm going to identify the port that I'm going to use for this procedure. So for this procedure, we are going to use the port that is closest to the primary bag. So we're going to be using this port. I'm going to go ahead and hang my secondary medication up. Right, and I'm going to clean that port for 15 to 60 seconds. Right, and then I can attach my secondary tubing. Right, now I want to make sure everything's open. All right, and now that I have my drops flowing, I want to regulate my rate. So like I said, I want to have 33 drops per minute, but I want to make sure I have 8 drops in 15 seconds. So I'm gonna make sure I can see I have my primary roller here, but I'm gonna be looking at my secondary chamber to regulate my rate. And I'm gonna start on 45 again. Okay, I'm gonna start on 12. Starting now. Got 1, 2, 3, 4, 5, 6, 7, 8. Okay, that's too fast. So I'm gonna slow it down a little. And I'm gonna start again, starting now. 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, slow it down a little bit more. I'm going to start counting right now. 1, 2, 3, 4, 5, 6, 7, 8. Okay, that was 8. I'm going to start again at 12 and count again. Okay, starting now. 1, 2, 3, 4, 5, 6, 7, 8. Okay, that was 8 drops in 15 seconds. So now starting at 30 seconds here. So starting at 6, I'm going to count for a full minute. Okay, starting now. 1, 3, 4, Right, I had right at 33 drops. Okay, so after I have my rate regulated, I would want to let my medication run in. And after 30 minutes is up, I would come back in. I would want to clamp everything off. Unhook my medications. I want to raise my primary bag back up how it was, and I want to make sure to regulate my rate back on my primary bag, what it was before. And then I want to assess my patient. I was assessing my patient the whole way through, and then I want to document the procedure, document the time, route, amount, medication, and the patient. And that's all.